Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and today we're going to be talking about hip pain. Now, hip pain is a common problem felt by a lot of different people. Mainly as we age, we tend to have more hip pain than when we're younger, unless there's some kind of injury involved. Now, hip pain can be caused by a couple of different things. It can actually come from the hip joint itself, but it can also be referred pain from the back or from the SI joint, which is where the spine actually comes together with the pelvis. So just so I can give you a little bit of visual of what we're talking about. So the hip joint itself is where the femur head comes into the pelvis, so that's that joint there. The SI joint is where the sacrum attaches to the pelvis, and when this joint gets irritated or aggravated, it can actually refer pain around to the hip. We can also have problems in the lower back that can create hip problems. So it really is important to get an exam by a doctor to determine where exactly the hip pain is coming from, so that you're not chasing the symptoms and actually getting to the root cause of the problem. So a couple of things that we're going to do today with Liz, my lovely assistant, is I'm going to show you a few different adjustments that we do for the hip itself, and then 3 different stretches that we do here in the office to help loosen up the hip. One is going to be the hip flexor on the front. The other is going to be the IT band, so that'll cover the side of the hip, and then the piriformis muscle will be dealing with the back of the hip. So first we'll show a couple different adjustments on how we can address some problems that may be causing some hip pain. So if we do have a problem where the femur head is restricted in the socket that it goes into, then we need to distract that femur head out, and we do an adjustment where we basically just do a distraction on the leg itself. So I'm gonna have you scoot down the table a little bit, please. There we go. And so we're gonna distract with my knees on her ankle, so it's pulling here, and then we'll just give it a few light thrusts like that, and that helps distract that femur head out of the socket, and if there is any kind of restriction, can help to break up some restrictions or maybe even some scar tissue that may be in there. So maybe flip over on your stomach. This next adjustment is going to be on her SI joint. So that's the joint where the sacrum, which is the base of the spine, comes together with the pelvis. This is a joint that needs to move when we walk. So if this gets irritated or gets restricted, it can create problems, and then those problems refer around into the hip. Okay, so for this we actually use our table to help with the adjustment, so it'll drop underneath her. That'll allow us to not have to put as much force into the body. So we'll find a couple of contacts, 3 quick adjustments there. And so that helps to level out the pelvis, get that SI joint moving a little bit more, and allow for the irritation to go away. The last adjustment would be for the low back. So again, the low back, which is your lumbar spine, you have nerves that come out of there, and those nerves run down into your leg. If it's higher up in your lumbar spine, the nerve actually runs to the hip, so it may be pain that's referred from the low back itself. So go ahead and lay on your right side. And so we'll show you how we do our low back adjustments. And nice and easy, not too much force that gets put in, that gets those joints opening up and takes the pressure off the nerve. So the last thing that we're going to do is we're going to do some stretches to help with the muscles that surround the hip. The first one, we're going to start from the back, work to the side, and then to the front. So the first one is going to be the piriformis muscle. It's a muscle that runs right along the side of your buttock, and it deals with external rotation of your leg, so it brings your leg out like that. So what we're going to do here is I'm going to bend your knee, and so I'm going to be pushing. So we're going to be dealing with this, stretching this muscle here. So we're going to be pushing towards the shoulder, and then we're going to rotate the ankle in, and then I'm going to have her push her ankle against my hand while I resist. By doing this and then relax, it allows me to push it a little bit further and get a better stretch. So do that again, and relax. And you can see I'm able to go a little bit further each time. One more time, and relax. Good. So that's the back. most popular muscle that we can stretch for the back of the hip. Now for the side of the hip, we're going to be doing stretching out the IT band, which is right here along the side. So if we're going to be stretching the right leg, we'll cross the left foot over, and then we're going to move this leg out a little bit. Put our knee against her ankle. We're going to hold this in place, and then I'm just going to push against her ankle. Now you push against me and relax. Push against me. Relax. And one more. And relax. And so that really helps to stretch that side muscle out. Now the last one is going to be the hip flexor, or the psoas muscle, which runs right here, and it allows you to pick your leg up like that. So I'm going to have you come a little bit closer. Now people that sit a lot, this is a popular tight muscle. If you're sitting all day, it tends to shorten that muscle, so we really need to get a good stretch. And if that muscle is tight, it can create all kinds of havoc in the pelvis and the hip region. All right, so let's scoot all the way, come all the way to the end here. Keep going, keep going, keep going. There you go, now lay back. All right, I'm gonna have you, so we're gonna be stretching the right leg. So I'm gonna have her grab the left leg here and scoot down a little bit more if you can. There you go, that's good. All right, now we're gonna push up here, and you can see that this kind of pops this leg up. So when it does that, we're gonna push down here, and that gets a good stretch right in here. So push it down, and I'm gonna have her push her knee up against my hand, and then relax. Again, relax. One more, relax. Now the key to this stretch is you need to have them near the end of the table so that we have some room to push down below the table. Let's go ahead and sit on this. So those are things that we can do here in the office. There's also stretches that you can do for those muscles at home. So if you want to just basically, you can Google psoas stretch, piriformis stretch, or IT band stretch, and you'll find a bunch that you can do on your own. It is a little bit more effective if we're able to do that here in the office, or if you have a partner that can help you with those. So if you do have any questions, or if you have anybody that you think might benefit from this video, make sure that you comment in the comments below, like or share, or maybe even tag someone that you think might be dealing with some hip pain. And if you have any questions for us here at the office, give us a call at 726-0422, or visit us online at wellnessspringfield.com. And we'll see you next week.
Extension of the spine will help bring oxygen. Hi, I'm Nancy Thompson, the Functional Fitness Specialist at the Springfield Wellness Center. I want to let you know about hip mobility today. I work with a lot of patients and clients here. There's a wide range. We have patients who are very inactive adults who sit at a desk all day and then they retreat to the recliner at home at night. I have patients on the other end of the spectrum, the high intensity exerciser, crossfitter, bodybuilder who probably does too much and is hurting themselves or having some chronic issues with often their hips. And so they have this thing in common. They have very, very inflexible or stiff hips. So surprisingly, these two very different patients need often the same type of treatment or mobility and stability exercises for their core to help maybe stabilize their hips and reduce the inflexibility of their hips. So these exercises I'm going to show you today are the foundational exercises for good core stability. They're going to hopefully bring about better stability of the core and pelvis that will lead to less muscles that are being overused in the hips or becoming tight from too much sitting. And we're going to do the exercises that are also going to take you through an active range of motion for the hip, again bringing about better hip mobility. So the first one is, well, they're all going to be done on the floor, so we're going to be able to isolate those muscles. The first one is a reverse crunch. Everybody that we see in here goes through these 4 foundational exercises. The reverse crunch is where we want to start by, I have most people lift their head and shoulders to help brace the core and the spine, and then we add leg movement by pulling knees in, and then inhaling and lowering heels down to activate the lower core muscles. This can be regressed by having the head laid back if that hurts or is difficult for somebody with neck issues to hold up. But again, we want to make sure they're bracing the core and bringing the knees in. We can even do one leg at a time if necessary if low back is an issue for some people. And then we can even add legs longer to progress the exercise. So there's things we can do to make it more challenging, but it's going to help strengthen the lower core muscles. The second one's going to work the opposite side, the shoulder bridge. We'll want to let the head relax, the shoulders stay down, the feet stay down, hips width apart. And then we have a pelvic tilt. We have our patients think again about stabilizing the core, pulling the belly button down, then lifting the hips up into the bridge to engage the glutes and the hamstrings. And that's going to help again balance out the stability of the lower core. So we'll want to do shoulder bridges as well. The next one we do while we have people reclined, we want to have people's arms out in a cross position. We start with the feet on the floor, and to strengthen the oblique muscles, we do recline twists, lowering the knees, not just letting them fall and twisting with momentum, but we lower, and then we lift the legs back to center, and we lower and lift. And again, as we progress people through, we bring feet off the floor, and we can bring the feet even farther away from the bottom to make the move more challenging, to strengthen the obliques in the center part of the core for that portion of our core stability. And then to take the hip through its active range of motion, we'll get people in an all fours position, making sure that they pull the belly button up to avoid any sagging through the lower back, to support that lumbar area. And then we start just by a simple fire hydrant move, lifting the leg up and lowering it down. Again, we always want to lift and lower, we don't throw and drop. And then we progress people into a full range of motion, and a lot of people can start right off with this and really work all the muscles, moving them as well as strengthening them through the whole active range of motion, doing both directions. And those are the 4 basic exercises. To keep it balanced, I always suggest people stay balanced in the number of reps and sets they do. So we usually have people do 2 sets for time reasons, 2 sets of anywhere from 15 to 25 here in the Functional Fitness Center, but at home you can even do more reps or add a 3rd set to really start gaining strength and then mobility in the hip joint, and hopefully improve your hip mobility and reduce strain on your hip and then probably your lower back. So those are some nice tips and foundational moves to improve hip mobility. If you found this information helpful, please share it with your friends. This is Nancy Thompson, your functional fitness specialist at the Springfield Wellness Center.